Going to have a little bit of banter here. All right, we are live, so welcome everybody, and we're well behind the normal 8 ball for the timeline that I usually use. So if you have questions for Claire during the interview, please ask them, and we may have a minute. I'll try to wrap things up so that we still do have a minute. If there are any questions, Claire can answer them, and then we'll go offline and still talk because we can't really debrief very well on Facebook Live and have a private
Sounds good.
conversation, a brief one. I always like to debrief with people that way. Your website is twosteps.ca,
Yeah,
the
you
the
got it
word
right.
two. Okay, so we'll do that. Oh, and yeah, basically, if I remembered to send you, I hope I remembered to send you the onboarding video. The
Yep.
way that it begins is just take us behind the talk, summarize your talk in about
Hmm.
2 minutes. Don't say
Yep.
they invited me to apply and then
No.
don't do
Nope.
that. Don't be
Nope.
that person because everybody
Nope.
used to do that for a while. Summarize the talk, tell a story. Whatever you forget is fine. Whatever you remember
Yep.
is fine. You already gave the performance. Then we're going to
Yep.
have a conversation. I'll hold true to the spirit of that conversation, Claire, and then we'll have the blitz round. That's the either or questions related to the performance and preparation of your talk. Then the final
Yep.
word of advice, and it's the
Yep.
fastest 15-minute interview you've ever had. Awesome. Well, good. Well, we'll jump right in here in just a moment. I'm just making sure I have everything in um, my little spreadsheet here. I think so. All right, Claire. We are live in three, two. We are live with Claire Snyman. Claire, are you ready to talk?
I'm ready to talk.
Claire Snyman is an author, blogger, and advocate for patient and healthcare collaboration. Claire is passionate about guiding people to put their health in their own hands. After her diagnosis with a non-malignant brain tumor, Claire realized the importance of partnering with her healthcare team and being her own advocate. Claire Snyman, welcome to the talk.
Thanks so much for having me on today, Nathan. I'm excited to chat to you today.
Your talk is called How to Save Your Life in a Complex Healthcare System. I don't think anybody who's watching or listening to this right now would deny it is getting more and more complex, and it's not the fault, I think many people would agree,
Hmm.
of the providers.
Hmm.
Please take us behind the talk and tell us really what made the difference for you in assembling your own healthcare team.
Well, thanks very much for that. And I think you're totally right, is that this is not a blame game. This is really to do with the fact that we are dealing with a very complex system, right? And what happens in complex systems is that we're dealing with two complex systems. We have a healthcare system, we have a complex body, and two of them working together, sometimes mistakes happen. And a lot of people don't realize that things like medical error is actually the third leading cause of death in the US and in Canada, and that's after cardiovascular disease and cancer. And as you were saying, is I had a non-malignant brain tumor, and when I was a patient, I actually realized during that journey that I really needed to get my action together, and I needed to figure out how to navigate this complex system. And so that's why I went and did a TEDx talk, because I realized that during this whole journey, I had figured out a way to make myself feel more comfortable, less uncertain, less afraid, and less confused, that actually ultimately saved my life. And so I wanted to share this message. We're only human after all, and I think that applies to doctors, it applies to nurses, it applies to everybody who's within this very complex system. So finding a simple and effective way for patients, for care partners to navigate it is really key. And that's what I went and I'm sharing that message of how to put your health in your own hands, because you might save a life.
Claire, what I love about your approach is, again, you said it yourself. You're not here to demonize anyone, and you're here to acknowledge the complexity of this
Mm-hmm.
system. I mean, I'm pretty empathetic to healthcare just because I come from a healthcare family, and I have seen my whole life, my family members really working with their hands tied behind their back. I
Hmm.
think is a good way to describe it because between the regulations, the legal threat of legal wrongdoing, the constant demands, the overwork, the stress, the strain, the kind of the lack of humanity from the provider side that they have to do day in and day out. It's just so refreshing to me to find other people like you that were able to find a way to work in a not optimal system, get what you need out of it, advocate for other people to get what they need without turning this into some kind of slugfest. So thank you for
Hmm.
doing that. What was key for you in realizing that the battle really isn't against other people? It's against the complexity of this system that really we're all fighting against.
I think for me was that there were, for me during my journey, there were small little mistakes that happened throughout the continuum of my patient journey. And that really made it clear to me that, there was this little thing that happened there, and it was because there could have been better communication. And then this little thing happened here because of this issue. And I realized that this was more a systemic issue than this one person here. Sure, yes, there was an individual, but actually this was because of more of a systemic issue, a lack of resources, a lack of funding in this area. And then I realized that actually the onus was actually more on myself, that if I needed to make sure that didn't happen, I needed to track my medical records. I needed to follow up on that area there. And I really needed to start asking questions more so that I knew what was happening in this particular area. So I was more the manager of my health, because that doctor was seeing maybe 15 to 20 patients per day, but I was just dealing with my one body. So if I was able to be more in control of my health, the outcome was definitely more positive for me.
And that's something that family members have always told me now that I'm fully, supposedly fully functioning, responsible adult. Having grown
Yes.
up in a family where all of this was taken care of me, I probably need to be the first person to sign up for any kind of coaching or product that you have, Claire, just because this is such a great message that everyone, I'm sure everyone listening to this, healthcare provider, would agree with, that they like to see patients that are taking ownership. So, what are
Mhm.
some really simple ways you're
Mhm.
talking about managing your own healthcare, your records? What are some really simple things that you began doing in your own life and that you also counsel other people to do, and maybe that I should start doing?
So I distilled it down to something really simple, because one of the challenges with me having a non-malignant brain tumor was some memory loss and so forth. So I needed to make it really simple. So I made it a team approach, and that's T, track. So track your medical records, your medications, ask for copies of your reports, and put it in a binder. So T, track. E, educate. Educate yourself on your condition, what's going on. Ask your doctor where you can find that information. Or yes, ask Dr. Google. But when you ask Dr. Google, make sure you ask him where the right stuff is and the reputable information.
That's an
So
important
T,
step right there
yes,
because my medical friends, they hate Dr. Google
I
because
know,
of the way that people use it to come to their own conclusions often. So thank you for mentioning
I
that.
know,
So we
I
have
know.
team is the acronym,
Yep.
track, and then educate.
Educate. And then A is ask. Ask questions. So before you go to the doctor, write down some of the questions that you have. So when you walk in, you actually are prepared, because they often say, do you have any questions? And you're like, I can't remember. I'm guilty of that. So be prepared. Have your questions down. So track, educate, ask, and then M, manage. So manage, set an objective for your health. What do you actually want to achieve for your health? And sometimes by setting an objective for your appointment, I want to go in, I want the doctor to help me manage my migraines. That's your objective. It makes it really simple and clear, and it takes the emotion out. So those four things: track, educate, ask, manage. By doing those four things, you're more likely to become an active patient. And that has got a huge bonus for yourself and the healthcare system.
All right, so I'm going to be able to remember that.
Yes, you
I
are.
don't have time to be present and write down notes, but it's
No.
track, educate, ask, and manage. And I love that, Claire,
Yeah.
because, if I'm hiring a mentor to consult with him or her, it's not going to be free, just like going to the doctor. It's not going to be free. This is like a almost like a mentor or a subject matter expert
Hmm.
for your health. Obviously, it's not free.
Yep.
You pay the copay. You pay a lot more than that. Why wouldn't you walk
Mm,
into that appointment with a whole litany
mm, yep.
of relevant questions to make good use of her time? Why would you
Yes.
not do that unless you had, unfortunately, and sorry, Talk Universe, kind of an entitled attitude that I kind of have, because
Mm,
I've always had all of this stuff taken care of for me, and that's exactly the kind of attitude that is not going to serve us. So I am
yep.
the hamster here today. I'm pointing the finger. No, I'm not pointing it at you, Talk Universe. I'm pointing it back at me. I'm going to track. I'm going to educate myself carefully with research and make
Yes.
sure I'm getting it
The
from
right
the right
research.
sources, and maybe even let my doctor know where I'm getting it from, and let
Correct.
let her steer me to the
Hmm.
right places. I'm going to
Yes.
ask, and then I'm going to manage.
And sometimes people are in a dilemma where perhaps that's too much for them to take on. Maybe
Mm-hmm.
they do have some medical condition, and then they can ask somebody to be a care partner with them, so that those elements can be matched up with somebody else. Somebody can help them manage or educate. Those roles can be taken on by somebody else. But just by doing those things, that really allows us to be more empowered and more activated in our own healthcare, which is critical. You know, we often take our health for granted until we don't have it. So.
Well, and I would imagine, to your point, with you as the example, when you are getting treatment in advance for this brain tumor that you
Mhm.
had, you might have been given meds
Mhm.
or things to ingest that could have been potent enough to interfere with a little bit of your mental function. You need to have a buddy. You need to have an advocate to come into the
Yes.
room with you to be able to
Yes.
make sure that that the communication is there instead of relying on oneself. So what a great,
Yes.
you're just answering all my questions here, Claire. This is wonderful.
No, I totally agree with you. Sometimes that's a good question on having someone by your side, because I used to go into appointments. I was totally overwhelmed. My husband would come with me and I'd walk out having one version of the appointment and he'd walk out having another. So sometimes when you're in that situation, it's often good to have somebody by your side just to take notes and so forth to make sure you have the same sort of end notes. It's really important.
We've been enjoying a really productive talk with Claire Snyman, whose talk was entitled How to Save Your Life in a Complex Healthcare System. And we'll be right back with the Blitz Round. And we're back with the Blitz Round. Claire Snyman, are you ready?
I'm ready. Let's go for it.
So I'm going to ask you a series of either or questions, and they're related to the preparation and performance of your recent branded talk. Here's question number one. Were you selected to speak, Claire, or did you apply?
I applied.
And are you a memorizer, an improviser, or a blender?
I'm a memorizer.
How did that work for you?
It worked well.
And I think the footage would attest to that. So that's excellent. What would you consider yourself a seasoned performer or newer to the stage?
I think well, a bit of both. I've done quite a bit of public speaking, but that was my first big performance.
And it's a certain kind of performance too. So that's
Totally.
I think when I ask this question, it's always a little bit new to the branded stage where it's an idea
Yes.
instead of the speaker that's exalted, and
Yes.
you have tight limits and you don't have a podium to hide behind, et cetera, et
Yes.
cetera. So now, Claire, did you have nerves, or were you in the zone, or neither, or both?
I definitely had nerves before, for sure. On the day, for sure. Not before, but on the day, yes.
On the day, how about when you walked out there?
Oh yes, definitely. And then I took a deep breath and got in the zone.
All right. So deep breath is key to and moving forward in towards the stage instead of away from the stage.
Yes, most
Taking the
definitely.
deep
Yes,
breath, going in the right direction, and
yes,
fulfilling your purpose there. Great.
yes.
Here's the cut for time question, Claire. What was the most painful part of your talk that you had to cut out?
Oh, that's a good question, because you know what? You probably know this too. I don't remember how many drafts I went through of my speech, cutting and cutting and cutting. So I don't actually know what the most painful part was of cutting out, because I think I went through 60 drafts, if not 70 drafts of my speech. So I can't answer that question on what was the most painful part of my speech to cut.
All right, Talk Universe, did you hear that? 60 to 70 drafts. And it takes
Yes.
some time to draft those things and edit those things. It's amazing. I was talking with another physician last week, and this is a physician in an academic environment. He was a
Hmm.
associate dean of a school of medicine, and he mentioned that he had trained, I believe, for no, it was 8 months for
Yeah.
his talk. Eight
Yeah.
months, and
Yeah.
the average successful talk, from what I've heard, is 40 to 50 hours of preparation. And, if you're doing 70 drafts, you're
Yep.
way above that. If you're
Oh,
doing
yeah.
8 months of preparation as this other
Yep.
individual, you're
Yep.
way above that.
Yep.
So good
Yep.
for you. And the
Yep.
footage definitely bears it out. You're
Yeah.
going to have to
Thank
check
you.
this out, Talk Universe, for sure. What's a tip, technique, or a tool that helped you prepare?
That's a good one. A tip technique that helped me prepare. I think the best one that I had was to think of some to actually be in the moment. So when I was in the moment, there was some very sort of I used a lot of scenes and a lot of story to get my message across. And actually, when I was in that moment, to actually go back in time to when that story happened and really immerse myself in the emotion, and that really helped for me to get the story, to get the message across. So I think that was important. Is story helps convey an emotion to help convey a message, and that was key for me. Even now, as I'm writing more speeches, that was an integral tip.
So you had the story, and what I also heard is you were presencing yourself, going back
Correct.
to that place,
Yes.
feeling the feelings, taking
Yes.
everybody right back there with you. Talk Universe, that's a powerful tip.
Yep.
Claire, what was the biggest challenge of your talk?
The biggest challenge of my talk was trying to get a a complex story with lots of different complexities into something that would be simple and conveyed over to an audience. And that was the challenge. And I think we were able to do that without people going, well, I'm not quite sure how that all got together. That was the complexity of it. So I was talking on a complex subject, but the actual nature of it was the whole story was complex. So yes, that was my challenge.
And I've got to throw this in here. I mean, I'm a good fan of solid acronyms,
Mm-hmm.
all verbs or all the same part of speech to make it easy to remember. And I can still remember team. It is,
That's
I
good.
can still remember. It's, can I remember the
Uh-oh.
T? Not train, not teach,
Track.
track. Thank you.
Yep.
Track, not engage, but educate,
Yep.
ask, and then
Yep.
manage. So thanks
Yep.
for the
There you
help on the
go.
first one. But I mean, that's the power of having a good acronym right there, even
Yep.
if you have to work on it a couple of times. Final question for you, Claire. This is a performance. So, what was the most unexpected, strange, or just plain weird thing that happened during or right before your talk? And you're
Oh,
already
I can.
laughing.
Because I already know what it is. During my performance, there's a very sort of emotional part where I'm thinking about looking at my son and the fact that I might not see him grow up. And I look straight out into the audience and I see him. And I see him in the audience and he's actually laughing because he's seen my talk so many times. And he's like, oh my gosh, here she goes again. And he's sitting out there with his hand over his mouth, having a little giggle. And I'm trying to be really solid and sort of in the moment. And I'm looking out and there's my 12-year-old son having a good old giggle out in the audience. And I'm going to have to maintain it.
That's
And
tough.
I
That's a hazardous. That's a real hazard. Family members in the audience who are
I
over
know.
familiarized with everything. Hey,
I
we've been
know.
enjoying a really a poignant talk with Claire Snyman, whose TEDx talk is called "How to Save Your Life in a Complex Healthcare System." In a moment, we'll be right back with the final word of advice, but I want to tell you where you can go to check out her excellent talk. You can go to our show notes page at bethetalk.com, and you'll have a link for the talk, and you can go and connect with Claire on her website, which is twosteps.ca, to the word to TWO steps.ca. We'll be right back with Claire Snyman and the final word of advice. And we're back with the final word of advice from Claire Snyman. What is it?
My final word of advice, I think, really is that everyone's health is too important to take lightly. So I think it's important for people to know that they need to take responsibility, to be proactive and put their health in their own hands. And how you can do that is you can have a team approach. And that is learn to track, learn to educate, learn to ask questions and manage your health because you might save a life.
Claire Snyman, thank you so much for this interview and coming and sharing your wisdom with Talk Universe today.
Awesome. Thank you so much for having me on the show. I appreciate it.
All right. And that's a wrap.
That was good. That was great fun. Thank you.
Yeah. Well, thanks for being so patient with my little technical issues today. I
No,
am
that's a
going
pleasure.
to, it looks like my RAM of my laptop was holding up okay. Sometimes, I mean, I've got 8 gigs on this
I can
laptop
imagine.
and,
I can
and it
imagine.
just sucks. And I went
Mm.
to it just sucks it all the way down and I don't have any programs of, I went to the Genius Bar at the Apple
Yeah.
store. They're like, use Safari. So I started using Safari, which I haven't done in 5 years. And
I don't use Safari
that
either.
didn't,
Yeah.
yeah, that didn't do anything. It sucked it
Oh,
down on Safari too. So, anyway,
strange.
so I'm logging into Facebook to see if there were any comments. I didn't see any on the software right here. I'm just trying to
Okay.
make sure. I apologize for the glasses and the ring light. Everybody can enjoy, this little strange effect right here, which is why I don't wear glasses when I'm
I know. I wear
interviewing
glasses as
people.
well. So yeah.
Looks like we
Yeah.
got some thumbs up. I don't think that we have any questions, which is
That's
fine.
fine.
And what I'm going to do, just because we're a little pressed for time
Yep.
on my
Oh,
end, I'm
yeah, no,
going
you got the
to
next one.
I'm going to end the Facebook Live. I'm going to take it private with Claire and debrief with you in private instead of on Facebook Live. And I know that there are some interviews that I did yesterday, and this goes extremely well with the message of those interviews. So I'm going to probably ping some of those people on this video, and love if you just left a comment for Claire. Also, take it over on BeTheTalk.com on the discussion board. Pay it forward. Let people know who uh, um, your favorite interview was. I think this is going to rank way up there as well. Take care, everybody.